And I'm very pleased today to have one of our clinical colleagues, Dr. Gretchen LaSalle, who's a family physician in Spokane, who's going to talk a little bit about herself and her practice at MultiCare. She is the 2020 American Academy of Family Physicians Vaccines Science Fellow. And what that tells you is that in addition to being a very gifted and talented family practitioner, she also has a lot of knowledge and credentials as it pertains to vaccines and immunization. So she's someone really, really good to ask your questions from, because I'm sure she will know and will have the answer, certainly knows a lot more than most of us will know. So with that, I'm going to ask Dr. LaSalle to come to the podium. I'll put my mask and move on. Thank you.
Thank you, Dr. Velasquez, for that very lovely introduction. My name is Gretchen LaSalle. I'm a family physician at MultiCare Rockwood Clinic. I've been here in Spokane for about 14 years now, practicing longer than that in family medicine. And I'm here today to talk about vaccines and to try to address questions and concerns that I hear really commonly in my practice. As a family physician, I take care of people from birth till the end of life and all phases of life and development in between. And so I have the occasion to talk about vaccines very commonly. My particular passion in medicine is preventive medicine. I want to help keep my patients healthy, keep them from suffering from disease, and vaccines are one of the most, if not the most effective preventive measure we've ever had in medicine. And so, I got involved in vaccine advocacy because I was hearing a lot of questions and concerns from my patients about vaccines that weren't true. A lot of misinformation abounds out there on social media and other places, and I wanted to be able to help guide them through their concerns and answer their questions with curiosity and respect. And so I'm here today to do the same for you. I have been in a vaccine science fellowship for this last year, which has been an amazing opportunity during a pandemic to learn about vaccines. So I've been sitting in with my two other fellows on all of the ACIP meetings, the CDC's Advisory Committee on Immunization Practices, which is actually meeting as we speak to discuss rolling out the Pfizer vaccine for 12 to 15-year-olds, sitting in with the FDA meetings and various other advisory committee meetings regarding immunization development, implementation, et cetera. And I have been extremely impressed with the diligence and the expertise that those advisory committee members bring to this discussion, and they're not letting the vaccination manufacturers off easy. They ask hard questions. They want to make sure that these vaccines are safe and effective. They're rolled out as equitably as possible, and so I have a great amount of confidence in the vaccines that we have available to us for COVID, and I've been anxiously awaiting today which we anticipate getting this authorization from the ACIP and the FDA to roll out vaccines to 12 to 15-year-olds, because I am a mother of two teenagers, and I have a 17-year-old who has already been vaccinated and a 14-year-old who we are ready to get vaccine into arm as soon as we can. So I'm excited to talk to you today about that. I want to discuss really quickly just that not only are we trying to protect our kids from COVID, the illness, they are less, when you look at sort of severe consequences of COVID in young people versus elderly, they are less at risk, that's true, but they're not completely without risk. So we want to protect their health, but we also want to get them back to being normal teenagers. We're seeing not only a pandemic of COVID, but an epidemic of loneliness and isolation and depression and anxiety. We're seeing kids slide backwards academically, and we want to get them back to their, ability to hang out with their friends and have sleepovers and go to dances and all these things that are really vital for the social and emotional development of our kids. So it's not just about protecting their health, their physical health, but also their emotional health, their academic health, and more. And so with that, I think I will stop and turn it over to our team to address some questions that you guys might be having.
Thank you so much, Dr. LaSalle. One of the questions that we receive a lot are, why should kids get the vaccine when they have very little symptoms and transmission rates? What is your thoughts on that?
Yeah, so we sort of touched base on this, that kids do suffer fewer severe consequences, but they are not, with a capital B, but they are not without risk. We have seen that kids have died in greater numbers from COVID than they've died from even a bad flu season. We know that hospitalization rates are higher for COVID for kids. And when I say kids, right now I'm talking 12 to 15 and older, but I'll say kids because no matter how old they are, they're always our kids. So I'm going to default to use that word. But hospitalization rates are higher than in a typical flu season. We're starting to see a larger proportion of people who are getting COVID be in those younger age groups. Now that many of our elderly folks and older patients are vaccinated, a larger number of young children and young adults are getting sick. We also know that there are some pretty severe potential complications of COVID. There's a condition called multisystem inflammatory syndrome in children, which can happen 2 to 6 weeks after infection and even after mild infection. And this is, results in over 60% of kids being admitted to the ICU who have that condition, and 1 to 2% of those children will die from that condition. So that's very serious. We're also seeing kids suffering, just like adults are suffering, from what we call long haulers syndrome or long COVID, where they have months after infection are continuing to suffer with fatigue and joint pain and mood and emotional issues, neurologic conditions, cardiovascular problems, not able to get back to being a kid. And so we want to prevent that. But additionally, we also have to recognize the role that kids play in transmission of illness. And so the CDC did a study last year in 2020 between April and September looking at hotspots around the country of COVID outbreaks. And they looked in the weeks prior to those outbreaks happening at who had the greatest percentage of positive tests. And it was, a significant number of our children, teenagers, and young adults had the most positive tests leading up to those outbreaks. So that just tells you that our kids can transmit this virus and can, to some degree at least, drive outbreaks. So transmission is an important part. And even if that, that COVID infection in the kid may be for some lucky kids no worse than a flu per se, they can transmit it to their grandparent who can die from COVID, or to a immune compromised relative who could really suffer serious consequences. So it's not just about the kid, it's not just about us, it's about protecting each other, protecting our communities.
Thank you.
Yeah.
Another question is, what are the risks to adolescent girls going through puberty and their chance of having children in the future?
Good question. This is one we get a lot. So the theory that the COVID vaccine would somehow affect fertility has been floated by a variety of people with sort of questionable motives, and is actually a claim that happens with almost any new vaccine that we have come to market, and it really is not an issue. There's a lot of analogies out there about this. If you talk to our leading virologists and immunologists, maternal fetal medicine specialists, they will tell you that this is not a concern. And my favorite analogy is a phone number analogy. So it says that it's like having the vaccine causing antibodies to the spike protein, which is what it does, the COVID spike protein, having any similarity to a placental protein and then attacking that placenta. The likelihood of that is similar to having two different phone numbers sharing one digit, calling one phone number and expecting to get the other phone number just because it has 1 out of 10 digits in common. So not at all likely. And we've seen people in the study, in the Pfizer study, got pregnant during the study. There were 23 people who got pregnant during the trials, about 50-50 between the vaccine group and the placebo group, and the only ones that had any adverse pregnancy outcomes were in the placebo group. There are studies called developmental and reproductive toxicity studies, or DART studies, and these are animal studies that they look at to detect if the vaccine causes any problems with fetal development or difficulties with reproduction or pregnancy complications, and they have seen none. We've additionally had more than 35,000 women now pregnant women have chosen to get the vaccine, and they are enrolled in pregnancy registries, and their pregnancies are followed, and then their babies will be followed for a period of time after to look for signals of concern. And there really have been none. Nothing in greater numbers as far as pregnancy loss or fetal demise or various other pregnancy complications compared to what we see in the general population before COVID vaccines. So that gives us a lot of confidence. Additionally, if you get COVID during pregnancy, that in and of itself is a hugely risky condition. Pregnancy is a relatively immunocompromised condition. We see our pregnant women suffer greater pregnancy complications, stillbirths, preterm delivery, high blood pressure in pregnancy, blood clots, having to be ventilated, and dying from COVID than we see in our non-pregnant patients. And in good news, we are starting to see, studies are starting to show that vaccinating during pregnancy can transmit antibodies to that baby, and vaccinating during breastfeeding can transmit protective antibodies to that baby. So if you are pregnant or thinking about getting pregnant in the imminent future, if you're thinking about getting pregnant, I would strongly encourage you to get the vaccine beforehand so that you're protected during that entire pregnancy. And if you are pregnant, talk to your doctor. They're going to be able to guide you in whether that's the right decision for you and what timing in the pregnancy that you might want to receive the vaccine.
And Dr. LaSalle, even though the risks that are mentioned lack evidence and or are very rare, why should we take that risk, not knowing what the long-term consequences could be of the vaccine?
So we are assessing risk in our lives every single day. When we hop in the car, we are taking on a certain amount of risk that we're going to get into a car accident. The likelihood of that, by the way, is way greater than the likelihood of any risk from a vaccine, which those risks, while they happen, are exceedingly rare. We don't know we've only had a year and a half or so living with this virus and less time living with the vaccines. And it's true that we don't have long-term data like we have had for vaccines in the past. But if we think about all other vaccines, and when it comes down to it, no matter what type of vaccine platform we're talking about, our body responds to that in the exact same way. And so if we think about all other vaccines that we've had for decades, there really are no long-term consequences that we see of vaccines 5, 10, 15, 20 years down the line. Whereas we definitely see long-term consequences of vaccine preventable disease. For example, chickenpox can cause a really devastatingly painful condition called shingles decades later. Polio can cause something called post-polio syndrome. Measles, 5, 10 years later, can cause a 100% fatal neurodegenerative condition called subacute sclerosing panencephalitis. You don't hear about it very often. But we definitely see long-term adverse outcomes from the illnesses themselves. We don't know what's going to happen in 10, 20 years with COVID vaccines, but I am much more worried about what we don't know about COVID than I am about what we don't know about the vaccines. So I would leave it with that.
Thank you. One question that a member on Facebook has is that if a person is getting vaccinated, is there anything that they should be doing to prepare for that? Should they have a PCR test ahead of time, or should they have their antibodies checked, or are there vitamins that they should be taking, such as D3?
I would say not necessarily in anticipation of getting a vaccine. We know that vitamin D3 can help support a healthy immune system. So I recommend that to all my patients anyway, no matter what. But in anticipation of a vaccine, really all we need to know is that, you can get it if you can and should get the vaccine, even if you've had COVID. We tend to wait about 3 months after a COVID illness because there's some natural immunity to COVID from the illness itself that we think lasts at least 3 months, but we have seen people get COVID more than once, and we know that there are variants circulating now out there that prior infection might not protect against, so we still encourage vaccinating even if you've had COVID. you may just not need to get it immediately. You may want to wait 3 months or so. The only thing I would say is that with vaccines, the first vaccine usually sort of primes the immune system, and it's that second dose of vaccine that really gives us a faster and stronger immune response that allows us to fight off the virus if we are exposed to it. So people who have had COVID in the past, that COVID illness was their first exposure, and then their first vaccine tends to be the bigger, robust immune response, where they may get a little bit more of that, what we call reactogenicity, that achiness or low-grade fever, tired, headache. So they tend to have that happen more on the first dose, whereas everybody else getting the vaccine who hasn't had COVID, the first dose typically gives them a little bit of a sore arm. That's usually the worst of it. And then it's the second dose that we have to expect a little bit more of that reactogenicity. So in my clinic, I just encourage people to prepare for that second dose, to have some downtime if they need it, to lay low if they need, if they get a fever, take some Tylenol, take some Advil, lots of fluids and rest. And those, if they're going to happen, those symptoms come on pretty quickly within 12 to 24 hours, and they go away within 1 to 3 days. So I personally had that on my second dose of Moderna, is what I had. But I was able to take some Advil and go to work. So, it's definitely doable. It's not the worst thing in the world. I can think of many more worse things in the world than that. And it's way better than getting COVID.
And you briefly touched on variants. Have we seen anywhere in the world where variants are affecting children differently, or maybe more so than the original virus?
I don't know that I have the information to answer that question. We're certainly seeing variants become a big issue overall. And I would make the leap to think that would impact children as well, but I don't know the data on that.
Okay. And then this question is about the clinical trials. There's some information maybe out there where they're saying that the trials are ran for only 14 days, but can you explain how through the trial process the participants in that trial, how often for how long they are watched and covered and symptoms reviewed going forward after the vaccine's been administered?
Yeah, so participants are followed routinely throughout the trial, and the reason that the FDA requires at least 2 months of phase 3 trial data before they'll even consider authorizing the vaccine is because if there's going to be adverse reactions, those typically happen within 6 to 8 weeks. Like I said, it's very rare that we see anything significant happening past that. So all the participants, adult and children, have gone through adults now longer, but children have gone through our 12 to 15-year-olds that at least that 2-month period of monitoring, and they will all be monitored for a period of 2 years going forward. And so this is how we know that our vaccines, for example, give us at least 6 months of immunity, because that's how long our trials have been going on. So we're able to follow them, and we will only know kind of in hindsight after looking backwards how long that immunity lasts, whether we're going to need boosters and all that sort of thing. But they are followed closely along the way. And I'll just put in a plug quickly for a program called vSafe. So if you get the vaccine, and I think we could be better about at our vaccine clinics telling people about this program. But if you get the vaccine, you can register with a program that's sponsored by the CDC called vSafe. And it is a smartphone-based tool where once you register, you get daily check-ins for the first week after your vaccine, asking how you're doing, and then weekly, and then monthly after that. So, we scientists, vaccine manufacturers recognize that this is a compressed amount of time that we've had to develop these vaccines. And like Dr. Velasquez said, that was for many, many good reasons, a lot of efficiencies in the vaccine process, not corners cut, and a lot of resources being devoted to this project. But they are trying to actively monitor people after vaccination as well to pick up any signals of concern that might be out there. And that has worked. We saw that with the Johnson & Johnson vaccine. And so now we've got, for the Moderna and the Pfizer, which are that mRNA type of vaccine, over 200 million doses administered. in our country, and really no major signals of concern. So I would encourage you to be part of that learning curve, part of that ongoing study of vaccine safety, which we all want to have, by registering for the VSafe program when you get your vaccine.
Thank you so much, Dr. LaSalle. That is all of our questions for today. So, Dr. Velasquez, would you like to close us out?
Thank you so much.
You're welcome.